everyone. I'm Melissa Budzinski, program staff at Gilda's Club, Grand Rapids. Thanks for joining us in this virtual clubhouse. We're so grateful we can come together and connect whilst all staying safe. Please let us know that you're watching by liking this post or commenting if there's something that you want to ask or some input you have about it. If you felt like this was helpful to you or someone that you know it might be helpful to, please feel free to share it or ask us for the link. We're happy to get you connected. If you're new to Gilda's Club Grand Rapids and you're on a cancer or grief journey and you'd like more information, you can give us a call, 453-8300, or look on our website and send us a message, gildasclubgr.org. So I have two wonderful special guests with us today because in March, we are thrilled to offer our Gilda's LaughFest again. So it'll be March 11th through the 14th. And two people are with me today. We have Joanne Roehm, who is the Director of LaughFest and Strategic Initiatives. Joanne has been the driving force behind the festival since the beginning. She has 15 years of experience in the nonprofit sector and emphasizes in project management, fundraising, communications, operations, and special events, which there are quite a few of in LaughFest. She is a committed and focused leader with a passion for employee engagement, cross-department collaboration, which is happening right here, right now, today, sustaining meaningful corporate culture and wellness. It's great to have you with us, Joanne.
Thanks for having me.
Yeah. Our other guest is Dr. Jayson Dibble, an associate professor in the Department of Communications at Hope College. Jayson does research and teaches courses on interpersonal communication, relationships, persuasion, and humor. He has authored and co-authored dozens of journal articles and book chapters. His research has been featured in a number of publications, including the Wall Street Journal, The Atlantic, The Woman's Health, Psychology Today, Yahoo News, and much more. In his spare time, he hangs out with his family and friends and curates and admires extensive collection of very rare vintage air guitars. Look at that. I'd like to see that collection there. So glad to have you with us, Jayson.
Thank you, Melissa. And I have to apologize for the cancellation of the smart person that you planned to be here instead of me. But I'm happy to fill in.
Great. Oh, I'm so glad that you could do that. We appreciate your flexibility. So it's so good to be together today to talk about not only the festival and what's coming up, but also this really important topic of humor and emotional health. But first, Joanne, why don't you tell us a little bit about the festival this year, what it looks like, and the history of it, and how we got here today?
Yeah, great question. How did we get here? So we're heading into our 11th year of Gilda's LaughFest, which is unbelievable. And I don't think anybody could have predicted, just like with everything else this year, that we'd be doing this in a virtual setting in 2021 in our 11th year. You know, we came up with LaughFest back in 2010 with the first festival happening in 2011. At that time, to celebrate our 10th year of operations for Gilda's Club Grand Rapids. We wanted to create a platform that brought visibility to Gilda's Club and the critical work that we do in the West Michigan community. And we were hopeful that Gilda's LaughFest would help diversify our revenue stream and provide some proceeds to our organization as well, which of course it's done both of those things. Now in 2021, we are in our 20th operations for Gilda's Club Grand Rapids. Yay, so exciting. Happy birthday, Gilda's Club. And the festival this year is going to be in a mostly virtual format. It'll take place over just 4 days instead of the traditional 10, as you mentioned, March 11 through 14. And we're just so glad that we could still deliver LaughFest, even if the format is different than what it would traditionally be, because I don't know any other time, at least in my lifetime, that as a community, we need to laugh and smile more than the place that we're in right now.
Yeah, I would totally agree with that. Yeah, very, very important this year. And really exciting that we're having this opportunity that we're bringing it in to the virtual realm so that we can still bring that very important message and opportunity to our community. Yeah, that's great. Well, Jason, you've been a member of the Laughter RX committee for quite a long time now. And could you just tell us a little bit about what Laughter RX is and what that looks like within the festival?
Yeah, so Laughter RX the RX comes from sort of the medical prescription. So it's sort of their shorthand of referring to a prescription, which gets at health and gets at well-being. And so Laughter RX, one of the taglines of LaughFest is it's seriously funny. And so we have plenty of the funny. So there's going to be lots of comedy events and lots of opportunities to laugh. But this is to focus more on the serious side of seriously funny, without being boring or stilted or anything like that. So I don't want you to think that it's just a bunch of seriousness, but it does remind us that of Gilda's mission, which is to focus on the benefits of laughter and humor for health and well-being. And we're talking about both your physical health, we're talking about your mental health, spiritual health, and so on. So Laughter RX is part of LaughFest. These are all events that are designed to emphasize or play up or remind to festival goers the serious side of what we're doing, and to make the connections between laughter and humor and physical and mental and emotional health.
Sure.
So we've got lots of different things like academic talks. There's panels sometimes that would happen, testimonial style presentations and performances. So these might be, there's still a performance there with a very talented performer, but the source material focuses maybe on their own cancer journey or their own journey through alcoholism or something else that required a lot of emotional labor in order to help them journey through it. And so there's all these kinds of events, laughter yoga, right? So everybody knows about yoga, the health benefits of yoga. Well, we find ways now to LaughFestize it.
Okay. Oh, that's great. And it really marries that Gilda's Club focus with the LaughFest focus. And it really makes me think often is that when we take new members through, we're walking through giving a tour at the clubhouse, that if they hear laughter coming out of the rooms, they're like, I thought this was a serious place.
So that means it's working.
Right. Yeah. We often talk about that when you are able to talk openly with acceptance about what is on your heart, what your experience is like, that it helps you to find your joy again. That it is not pulling your bootstraps up and setting things aside. It's dealing with the hard, tough stuff, and that leads to finding that joy again.
Yeah.
So what you guys are talking about really is exactly that, is marrying both of those things.
And it's just, with the Laughter RX side, it's just, we're very intentional about putting the serious part front and center so that people can see. We do believe, of course, there's lots of benefits to just sitting and laughing with a group of people. There's nothing wrong with that. But sometimes we need the reminders about the connections between physical health, mental health. And so these events are designed to call attention to those links.
Oh, wonderful.
And LaughFest too, from the beginning, we know that the work that we do at Gilda's Club and the subject matter that we deal with in cancer and grief predominantly, like that's difficult things to talk about. We don't do well societally in talking about hard things. So LaughFest was really designed to be an accessible way for us to introduce that mission and those tough topics to the broader community. If we'll say often, if we were going to have a cancer and grief festival, wouldn't quite have the same feel to it, but by bringing LaughFest to the forefront, it creates that really accessible way for us to start having bigger conversations about those tough things that almost all of us navigate at some level throughout our lives.
Yeah, exactly. Oh, that's great. Well, Jason, you're part of this Laughter RX Symposium this year. Can you tell us a little bit about it, what the focus is this year, or what the topic is?
So I guess last time I mentioned the academic talks. I guess I represent the stuffy academic. And so one of the things that I do is I research interpersonal communication, and a lot of that involves humorous communication. So through some of my research and through some of my teaching, I had been reading quite a bit about humorous communication and humor in general. And so over the last couple years now, this is our second time doing the symposium proper, but I have been sort of giving these ad hoc talks as part of Laughter RX for the past several years. And what we're looking at there are what does the research actually tell us about laughter, humor, and health. And so I was looking at, you do hear a lot of people just sort of lay speaking about things like, well, laughter is the best medicine. And there's a lot of sort of folklorisms about, there's a folk understanding that, of course, humor is great for you and laughter is great for you. And some of those ideas, I think all of those ideas are well-intentioned, that we mean well by that, but there are limits to what we should actually be saying about the links between humor and health. And sometimes those limits matter. And so what I started doing a couple years ago was digging into the research and what do the data actually show as far as health benefits to laughter and humor. And in what ways is it good? And in what ways is it not necessarily either not good or maybe even harmful? In some cases, certain kinds of humor can backfire on us. So the idea is with this talk to bring more nuance to what we should really be saying or what we could really be saying about the links between humor and health. And this year, I'm going to add another component to it, which is to focus on what do we know about emotions in general. And so, of course, one of the missions of Gilda's is to focus on emotional health, cancer and grief, but also emotional health writ large. And so anybody who wants to help understand or help somebody journey with their emotions really needs the most up-to-date understanding about what do we know about emotions and how emotions actually work. And I've been reading some newer research over the last couple of months and the last year that has just rocked my world in terms of what I used to understand about how emotions work. And I actually bring this now into my classroom here at Hope. And I can't teach the old textbook ways about it anymore because the new data are just so glaring and do a better job of accounting for what really happens versus the old way of thinking. So that's a big fat teaser to say you're going to come in on that day and be prepared to have everything you knew about emotions be turned on its head.
Wow. Yeah, really sounds very interesting, and I am interested to hear what you have found.
So then the idea is, humor is one of those emotions. So if you want to be able to properly connect humor to health and so on, we need to understand how that emotion works. And in order to understand how that emotion works, you got to zoom out and look at what does science show us about how emotions work in general.
Yeah. Oh, that's great.
So for example, emotions, we're always taught that I don't know if you were taught this, Becky, if you ever took a nonverbal communication class back in college, but you were taught there were 6 universal emotions that all cultures and all people can show, like happiness and sadness and disgust and all this kind of stuff. And it comes out on your face, right? There are these universal facial expressions that we have, and that's how we can read each other's emotions. That is all a big fat myth.
Wow.
It turns out there are no biological fingerprints to emotions. And that emotions are real and they do occur inside your head, but your brain constructs them on the fly. They're not these pre-programmed circuits that get triggered by something, which you were taught that too, right? You triggered me, or you made me angry. We don't make anybody angry.
Mm-hmm.
We also don't make anybody happy. Our brain constructs those things not in response to what's happening in the world, but as predictions about what it thinks will best serve you as you go about your day.
Oh, how interesting. That's a little more intricate than what.
Yeah.
Right.
So I'm going to be talking about agency. I'm going to be talking about empowerment. I'm going to be talking about you're not just at the mercy of your emotions. Emotions don't happen to you. Your brain constructs them. And that includes humor. It includes fear. It includes anger. And they're not biologically hardwired into you. You have to learn the concept for that emotion before you can even experience it. So a lot of people are going to go, it's going to be like heresy to some people because it flies in the face of everything you've learned about emotions up to this point, including me. But I'm a scientist, so I have to follow the data. And if the data if your theory doesn't account for the data anymore, then you need to get a better theory.
Yeah.
So that's going to be this talk.
That's great. That sounds really interesting. Joanne, did you want to say something?
Real stuffy academic, right? Here, real stuffy.
I was going to say, your nerd hat is showing, Jason.
Next slide, please.
Data.
Next slide, please.
Yes, but yeah, that sounds great, and I'm looking forward to that, and I'm sure that you have raised a red flag for a lot of people about being interested in learning more about this and self-agency and this interesting new study in emotions. That's great.
And that's the idea. It's not trying to just tell people that what you thought was wrong. Right. No. Our goal is to empower people and equip people. And that includes the caregivers who will be attending to our symposium who want to provide the best care. Right. Well, in order to provide the best care, you got to really know how the machine works.
Yeah.
And if the machine doesn't work the way we thought it did, then we need to update our understanding about the machine.
Yeah, that's great.
I know I'm totally mixing my metaphors there.
That's all right. That's right. We'll get it down. That's good. Joanne, do you want to talk a little bit about the CEU piece to this symposium?
Yeah, so we should state, first of all, the symposium is happening on Friday, the 12th of March at 9 a.m. Virtually. And you can register at the LaughFest website, laughfestgr.org, search symposium. It's going to be about a 3-hour event. Jason is our stuffy academic host and will open with his talk. But then we also have a doctor and a music therapist who will be presenting. And
a real doctor. I'm not a real doctor, right?
A medical doctor.
You know, a real doctor.
And participants will be in social work and nursing will be able to earn 3 CE credits by attending the symposium, including 1 in pain management. So we're really hopeful that this opportunity will be well worth it for just a $35 registration fee to all those incredible medical professionals and social work professionals out there. To continue keeping up with the science and the medicine and the therapy aspects of the work that they do.
Oh, that's great. And so just getting on that LaughFest website, you can just register right through there. If you have any questions, they can just let us know, call us or email us. And excellent. That's wonderful.
And the registration's open now, right, Joanne?
Yep, registration is open now and goes all the way until the day before the symposium. But we encourage you to register early and snag your spot for that. And Last year, we had about 100 attendees for the symposium. With it going virtual, that actually allows us the opportunity, capacity-wise, to have even more, and people from all over the country too. So we're really excited to have a nice group with us on that Friday morning.
That's great. Wonderful. And there's a $35 fee, is that correct?
Yep.
So, and that covers CEs and everything.
That's all in, $35. Yep.
Great. Wonderful. And a deal to boot. So that's great. So you mentioned a little bit this exploring pain and disease, and in focus of humor. And I just wondered if you wanted just to say maybe just a little bit about that also. Jason.
Me or Joanne? Me? Oh, sure.
If Joanne wants to talk on it, I'd be interested
to hear. Yeah. So pain, of course. Well, this is part of. It's sort of a twofer here. We get one of the things is with the continuing education, caregivers, nurses, and so on. They have to get continuing education on pain and pain management, and so they have to learn the latest and the greatest. And this is a great opportunity for us at with LaughFest and the Laughter Rx Symposium, in that we can help them gain their pain CE. I'm not trying to be alliterative here. They can gain their pain CEU in a way that also helps advance Gilda's mission of connecting humor and health, because we do have a sizable research that shows links between pain management and humor. And so, for example, there are some data that show that people who experience really, really funny material and they laugh boisterously require less pain medication than those who don't. And so there are some links there. We're not exactly sure what the mechanisms are, whether it's a distraction because it keeps you from focusing on your pain, but people will report that they don't feel as much pain when they're experiencing something that they genuinely find funny. And so there is a link there. And I'll be unpacking that a little bit in my talk to say, what does the research show about it? But then we're going to bring in the MD to kind of bring more of a medical side to it, and to say, what does this look like in the medical boots on the ground, so to speak. So what are the nurses seeing? What are the doctors seeing? And what can they say about it, about managing pain? Great.
Oh, that's awesome. And I think a very important piece of this is knowing that people are not necessarily going to learn just about emotions and laughter for the health of it in general, but also there's this practical application about this pain management, and also for social workers like myself, that we get that CE, which is really important because every year we need to renew that. And so it's an important piece and an important thing to talk about, especially in today's age of really managing everything with pain medication and pain management and all of that, and both cancer journeys and other kinds of diseases. Big deal, a big deal right now. So,
well, and pain is such a huge, people experience chronic pain in the best of times. We're also living through a pandemic right now. And so pain is on everybody's mind. There's pain, physical pain associated with the disease itself. There's the emotional pain associated with watching a loved one deal with, have to be alone in a hospital because everybody else has to be gowned up and you can't take any chances. So there's the pain of the social isolation. I think pain's the word right now. Yeah. And so it's perfectly fitting that one of our speakers is going to focus on pain and pain management and hopefully give us the latest and greatest.
That's great. Yeah. Joanne, did you want to say something? I noticed you.
Oh, I'm just agreeing, nodding and agreeing. the note about, the pandemic, well, it's certainly not a focus of the symposium. That is interwoven in everything that we do, right? It's a big piece of why we wanted to make sure we could deliver LaughFest this year. It's why the symposium becomes even more important than it was last year in supporting our healthcare professionals as they navigate their regular job and work, but then with this pandemic layer on top of that. And so there's no way that won't come up, I think, in there.
Yeah.
And also you and I, Melissa, are working on another event during LaughFest that's really going to touch on that directly.
That's right. Well, in bringing that up, do you want to just enlighten us on what other Laughter RX topics there are in the festival that people can tap into?
Yeah, so the two I really wanted to call out have been mentioned a little bit, but we'll dive a little deeper. The Laughter Yoga, which has been a fixture in the festival for many years, and that was something that was important this year too, even though the festival looks and feels different and is in a different format. How can we incorporate some of our normal programming and events and sort of festival whimsy that happens? And that Laughter Yoga is certainly one of those, and we're really looking forward to offering that in a virtual setting during the festival as well. And then the panel that you're facilitating, Melissa, and that's titled Navigating Life's Tough Stuff During Tough Times. Where we're really going to be bringing together a panel of people who are living with cancer, living with grief, living with addiction, and living with anxiety, and talking not just about their journeys and their emotional health as they navigate those things, but the impact and potentially the compounding of COVID and the pandemic on those journeys and how that has really impacted the way that they've been living with those things. And so that's a really important conversation within the Laughter RX track of programming during the festival this year as well.
Oh, that's great. Yeah, really, really important. And I think, in addressing bringing together that piece of pain that comes with this pandemic and these journeys and talking about it actually is one of the ways to help reduce, right, that. And so that's great. I'm looking forward to moderating that and to hearing what people have to say about how they've managed that and what has worked for them. So, and I was thinking too that now that has just totally left my mind, but I know now I remember that some of this will be recorded. Is that correct? Like the Laughter Yoga, a couple of these will be, and then they'll be accessible for people to watch over and over again from our website. Is that correct?
Yeah, so all of the programming during the festival is happening live, which is super exciting. You're not watching a ton of pre-recorded content. It's live in studio, so there will be flubs like there are with anything live along the way, but that's what makes it creative and fun. And for our donation-based programming, so the free events during the festival, they will all have an air time, and you can find the full schedule on our website. But after they've aired during their time slot, they will be available for the rest of the festival for viewing. So if you can't make it right at that show time or you want to watch something again, you can absolutely do that. For the shows that are part of our premium pass, those are one and done. It's like going to a live show. You got one chance to see those unique experience and then it's done. But for the donation-based programming, which the majority of the festival is, yeah, you can view that content throughout the festival.
Great. Oh, I think that's really helpful. If people want to do yoga laughter more than once during the festival time, that they can do that if they find that helpful. So that's great. Awesome. So what are some other events during the festival that you're excited about, that you want to talk about, highlight?
Yeah, well, there's so much. It's, It's a terrible time that we're in for a lot of reasons, but it also gives us an opportunity to be even more creative and innovative in the things that we do deliver, right? So this has been a real challenge and opportunity for the festival and those involved with it to come up with some unique programming that we haven't done before. One that I'm really looking forward to involves our friend Chef Jenna from Amore, who's done all kinds of things for Gilda's Club throughout the years. She's
so great.
She's wonderful, yeah. And she's going to be partnering with Adam Deggy, who's a local comedian, and they're doing an event called Cooking and Comedy. And Jenna's coming up with a cocktail, an appetizer, a main course, and a dessert. We're going to have the full grocery list posted online, and she's going to teach Adam how to cook it live, and you can cook along at home if you want to. We've never done anything like this before as part of the festival, and I just think it's so creative and unique and highlights some amazing talent in our West Michigan community. And that's a donation-based event. So that's one that I'm really excited about.
That sounds great.
With that one, you're going to have to see, can the chef not be as funny as the comedian? Who's going to be funnier? If you know Chef Jenna,
Right.
it's a perfect match.
Yeah, it's going to be a blast. We have a lot of family programming that's happening during the festival that I want to call out, just like we would in a traditional festival year, particularly if you have small children at home. You're looking for creative things right now to do after almost a year of pandemic. So we've got a virtual kids hip hop workshop. We've got a kids joke contest that submissions are open for right now. And we'll be showing those kids joke sort of in America's Funniest Home Video sort of setting without Bob Saget. We've got Alan True, So Much Better, a local comic, who will be taking care of that. We've got a family improv workshop that's happening. So lots of fun things for kids and families to do as part of the virtual festival as well.
Oh, that sounds great. And right here on Facebook Live, Alan True will be doing a joke workshop with myself next week. So that's exciting. So you can tap into that. And this is recorded, so you can watch this as many times as you want also. And next week, you know, our Alan True. So that sounds great. I'm so excited. Those events just really sound rich and inviting, and
the festival is always try to have something for everybody, and that continues even in a virtual setting. So while it's a smaller number of days and fewer shows this year, it's a really diverse and eclectic lineup. And I do want to call out those premium passes too that I mentioned. So the ticketed shows. Our premium passes for the festival are $40, and you get 6 incredible shows, including Michelle Wolf, Ron Funches is doing his podcast, Getting Better. You've got Tom Papa from NPR. I mean, it's just a wonderful lineup of shows for just a $40 premium pass. So get creative at home as to how you're going to have your big night out on the screen with LaughFest, and snap up one of those virtual passes, because it's an amazing deal for some really incredible talent.
I was just going to add, don't be afraid of the virtual format, for real. I know a lot of people are like, well, we just can't do it. And we're not going to say it's the same. I mean, that's not the goal. The goal has always been to find ways to deliver funny, find ways to deliver connection. And we're going to do that no matter what the medium happens to be. And so go in with a spirit of, I mean, you sit and watch Netflix specials at home on your couch. You do pay-per-view where you'll pay $100 to watch 2 people bash each other's brains out. You know, why not $40 to watch some serious top shelf comedy? These are the greatest comedic minds that we have, working comedians right now. Turn it into a party where safely with the people that you're in your bubble. Right? So get the people, pop up some popcorn, get some pizza going, mix up some drinks, watch Chef Jenna. She'll show you how to make some cool stuff.
Right.
And then turn this into a social event at home. Because there really is, I mean, that's the whole idea here is humor, laughter. None of that is designed to be experienced by yourself.
Yeah.
You have to experience it with somebody else. Even laughter, People think it signals humor. It doesn't. It signals communication. And so people laugh sometimes when you don't find things funny. Laughter still comes out. It doesn't always mean you think things are funny, but it does mean it's a communication device. It's designed to be social. It's designed to be shared with others. So don't be scared of the virtual formats. I mean, heck, you spend your time going to your Zoom meetings virtually anyway. You might as well be doing something more fun virtually. And don't be afraid.
That's great.
Well said. And it's that sense of community, right? And that's the parallel and the relationship with Gilda's and LaughFest is at Gilda's Club, whether it's in person in our clubhouse, which we can't wait to safely be back there, but right now in a virtual setting, it's that shared experience and sense of community that you experience at Gilda's with people in your groups who are navigating similar things, or at a LaughFest show, that laughter and community that happens when you're sharing that unique experience as well. And that, I think, I'm not an academic or a social worker, but that's what I think we're missing so hugely right now is that sense of community and being together and experiencing things together. So this is still not in person, but this is the next best thing that we can do right now.
Yeah.
Yep, that's so important. And we don't run away, because you still can put back in some of those feelings of community.
Yeah.
Even what we're doing right now says there's somebody else out there in the world who gives a darn about me.
Right.
And there's somebody out there right now who is responding to and reacting to what I do in the world. And we can still deliver that, even if we can't be physically in the same room right now.
That's right.
So we can still sharpen our community skills, our community building skills. We can laugh. But I would strongly encourage you, to the extent that you can, try to form a little audience when you log in and you watch some of these headliners and do some of these shows, because then you can capitalize on the social facilitation effect, we call it, which is things are funnier when you're not by yourself, when you're in a group.
Yeah. Well,
So get the kids all together.
Right. There's so many ways to do that, because people could watch it and then get together on Zoom and talk about their experience.
Yeah.
Because the replaying almost is even funnier than the actual watching sometimes, at least for me. And so there's just lots of ways to do it while still staying safe and not having to necessarily have 100 people around you.
And that's a great point you brought up too, is to use some of these events as a springboard for conversation.
Yeah. Yeah.
Right. So they sit and they can watch your panel where they can talk to, what is it? You got Aaron and Margot. I don't know who all's on your panel there, but you know, they've got some pretty amazing journeys that they're prepared to share. And it's not just a one and done, but take these ideas and then talk about it afterward. Let the ideas percolate.
Right.
And be able to respond to them and react to them in your own communities and in your own social circles, because that's where the real value comes.
Yeah, right. That's exactly right. So use that as a jumping off point for conversation with other people in your life, or even with us at Gilda's Club, you know, is reach out or comment on the Facebook recording or live and let us know what you're thinking, and that we're willing to have a conversation with you. And then I have one other question, and then we're about ready to wrap up, is that if someone is having technical difficulty and they're wanting to be able to participate in the festival, is there technical help for them, Joanne?
Yeah. Yep. So the good news is we are in this environment right now where we're getting quite used to this, and we're using 2 platforms for the festival, Zoom and Remo. Zoom is certainly one that a lot of people are familiar with. Remo, perhaps not as much, but it really is click on a link, enter your email address, and you're in. It's that simple. We do have on the LaughFest website right now, we have a phone number, we have an email address, and we'll have chat moderators during the events too that can help you if you're having any issues. So don't let that be a barrier for you. And if you are worried about that going into it, please feel free to give us a call as well. We can talk you through it.
Excellent. That's wonderful.
It won't just be people complaining on Twitter and somebody fixing it like the Golden Globes.
Right.
I think like that.
Yes, no, truly, this is in this together, in so many layers of it, and so appreciative of our desire and our mission, and the both of you in helping this, and is really staying connected and continuing to be together in this, and so glad for that. Well, Jason, thank you so much for spending some time with us today.
This was fun. Thank you.
Yeah, you're welcome. And Joanne, thank you for joining us also. I'm sure I'll see you soon.
Of course.
And all of you out there, thank you for watching. If you are interested in the festival and you still have questions, please just let us know. Either comment on this recording or just call us 453-8300. Or get on our website, gildasclubgr.org, send us a message, look up LaughFest, LaughFest, I'm not going to say that email address correctly.
Well, you can go to the LaughFest website if you can't find it through the Gilda's website. I mean, they're linked together, one organization, but laughfestgr.org is where the festival specific info is.
There you go. So reach out. We love to stay connected. Also, again, if you're on a cancer or grief journey and you're new to Gilda's Club and you'd like more information, we want you to know you're not alone. Our cancer and grief program is 100% free, no charge to you, your family, or your insurance. We would love to get you connected. Just reach out and talk with us. So other than that, I hope you guys have a wonderful sunny day. The sun is out, and I hope you get some time to enjoy that. Everyone out there, stay safe, stay well, and stay connected. Take care.